Hello, Professor Glaudet. I'm John. This is my wife, Suzanne, who signed the contract to be my test patient today. Is that okay with you, Suzanne, if we use you as the test patient?
Sure.
You can stay in these clothes. This isn't a doctor's examination. There's no need to get in a hospital gown. We'll be doing a head-to-toe assessment. It'll take about 20 to 30 minutes. And it would be the type of assessment that a nurse or an advanced practice nurse would be doing. Okay?
Okay.
So the first thing we do before any assessment would be to wash our hands. So I'm going to go over to my hand sanitizer. I'll wash my hands here. Make sure they're thoroughly sanitized. And I start by looking at Suzanne's overall appearance, making sure that there was no jaundice, cyanosis, that she wasn't in any distress in any way before I began this assessment. We would also have gone over her past medical history, looked at her medicines, her family history, and that may guide some of the more focused assessments that we would do, having knowledge of that past medical history. So we'll start by palpating your head. So I'll put my hands in your hair, if that's okay. All right. So I feel for lumps and masses, which I don't feel any, and ask, do you have any tenderness here?
No.
Anywhere? No? Good. Okay. Can you raise your eyebrows for me? Can you close your eyes tight? Nice and tight. Don't let me open. Good. Can you smile? Can you puff out your cheeks? Good. Can you clench your jaw tight? Good. All right, and then palpate your temporal arteries. Good pulses there. Any tenderness there?
No.
I palpate? No? How about your jaw? Any tenderness here? Can you open your jaw for me? Move it side to side. Thrust your jaw forward. Good. Any tenderness there?
No.
No clicks or pops either. Can you clench your jaw tight again? Don't let me open. Good. And check your sinuses. Any tenderness here?
No.
Any tenderness here? No. Okay. Good. So next we move on to your eyes. Normally we would have a Snellen chart, which would be that classic chart on the wall with a big E on the top. And we would look at the line that reads 20 feet and see that you could read that line from 20 feet away that your average person could read to see if you have 20/20 vision. We don't have the chart here. You wear contacts? Okay, so you have those in?
Yes.
Okay. So what we're going to do is we're just going to get some normal size print and hold it about 14 inches away. And I'll have you cover your left eye to start with. And can you read this line here?
When making decisions about how a patient is progressing.
Good. Okay. Can you cover your right eye? And hold the next line.
Along a developmental trajectory, the nurse needs to
Good.
use evidence.
Okay, good. So you did well on that. And the next thing we're going to do is test your peripheral vision. Okay. So I'm going to try to get this in the photo, in the camera shot. So have you just face me.
Okay.
Okay. Good. And cover your right eye for me. And tell me when this pen light comes into your field of view. Okay. I'm going to bring it up here.
No.
Good.
No.
Good.
No.
Good. Keep that eye covered.
No.
Good.
No.
Good.
No.
Good. Okay, cover the other eye. Okay, same thing.
No. No. No.
Okay.
No. No.
Good.
No.
Good. Okay, good. And next we're going to check your pupils. I'm going to check your extraocular movements, okay? The 6 cardinal fields of gaze. I'll have you look. Just follow this. Don't move your head. Follow this light with your eyes, okay? Good. All right. Now look straight ahead at me and then test your corneal light reflex. Good, nice and even. And then I'm going to check your sclera and your conjunctiva. Make sure they're not red. Good. Okay, no redness there noted. Check your pupils. All right. Bright light here. Good. Bright light here. Good. Nice and reactive. Okay. And then look at the wall behind you. And then look at me. And then follow this pen light in. Good. All right, that looks good. And then we're going to check your ears. Okay. Let me sit straight forward again if you want. Thank you. Check the outside here. Good. That's good. No lesions. That's good. Any tenderness here?
No.
Any tenderness here?
No.
I'm going to check your hearing. I'm going to do what's called a whisper test. I'll have you block your left ear while I whisper in your right. See if you can tell me what I'm saying.
Basketball 26.
Good. And now the other side.
Skiing 88.
Good. Now take a look at your nose. Looks nice and symmetrical. No lesions on the skin or abnormalities there. It's proportional for your face. Okay. Can you block one of your nostrils and breathe to the other side? Okay, and I'll try it on the other side. Good. All right, that's good. And look at your mouth and your teeth and your gums. Okay, can you smile for me? Good. Can you open your mouth? All right, no obvious cavities. Your cheeks look good. You can move your tongue to one side and the other. Lift your tongue up for me. Good. Can you stick your tongue out and say ah?
Ah.
Okay, good. Your uvula looks nice and centered and your soft palate moved up appropriately. Next we're going to check a gag reflex, which we're not going to do because that's kind of cruel and unusual punishment at this point. You just stick a tongue depressor in the back of her throat and make sure she has a gag. We're not going to do that. And finally, can you stick your tongue straight out? Okay, good. And the tongue is nice and centered, no foul odor to the breath, and no tremors in the tongue, so that's good. All right, so now we're going to move on to the neck. And the first thing we're going to do is just take a look at the neck, make sure there's no abnormal pulsations, no lack of symmetry in the neck at all. That looks good. And then we're going to check the lymph nodes in 9 different locations. Okay, no swelling noted in the lymph nodes at all. Check your carotid pulse, one side at a time. Nice and steady there. Make sure your trachea is midline. And then we're going to move to the posterior. Check your thyroid, okay? I'm just going to move behind you. You're fine right there. Okay. Can you swallow for me? Good. No nodules noted there at all. I'm going to inspect your back. Looks nice and symmetrical. You lean your head forward for me. Good. Okay. Go ahead and pick your head up. And no lesions noted. Your spine is midline. The skin, if this was a full examination, I would check the skin as well. That looks good. I'm going to check chest excursion. Go ahead and take a deep breath in and out. Okay. And I have symmetrical expansion of the chest, evidenced by my thumbs moving apart equally. I'm going to check for CVA tenderness. This is a test for kidney pain. Tell me if you have any tenderness here.
No.
No? Tenderness here?
No.
No? Okay. Take a listen to your lungs here. Nice deep breaths through your mouth. If you get dizzy, let me know. Deep breath. Deep breath. 2 more. Good. Okay. All sounds good. And I'm going to take a look at the front of your thorax. It looks nice and even, good coloring. No pulsations noted or anything like that. And take a listen to your lungs in the front as well. Take a deep breath. Through your mouth, please. Okay. Good. 2 more. Good. Good. All right. And last but not least, I need to listen to with the bell here. I would listen to your heart as you lean forward. Exhale for me. Good. And no murmur noted there. Okay, good. All right. Let me check the range of motion of your neck. Okay. You touch your chin to your chest. Your head all the way back. Good. Touch your shoulder to an ear. Shoulder to your ear. Ear to your shoulder. Good. Turn your head side to side. Good. And I'm going to check your strength when you do that. Okay. Can you lean again? My hand. Good. Try to pull your head back. Good. Try to turn your head against my hand. Turn your head to one side. Turn your head this way. Good. All right. Very well. Right. And now we're going to look at your upper extremities. Look at your hands here. Hold your hands out for me. Good. No lesions noted. Skin looks good. No cyanosis. Any pain in your joints here?
No.
Okay. Check your temperature. Your hands feel nice and warm. Okay. Look at your capillary refill. Less than 2 seconds there for sure. Check your pulses. Pulse there. Your lymph nodes. It's good. Pulses. Brachial pulse and radial pulse. And the lymph nodes feel normal. Good. All right. I'm going to check the range of motion of your shoulders. Okay. I have you take your arms, the palms out, lift them straight up over your head. Good. And then bring them down behind your back. Cross your arms. Good. Take your arms straight out and bring them down as far as you can. And now move them behind your back and cross. Good. And then back out. Bring them up. Face your palms out. And turn your hands in. Turn your hands out. Put your hands straight out. And flip them over. Good. Can you bend your wrists down for me? And bend your wrists up. Spread your fingers apart. Make a fist. Good. Okay, I just want to test the strength of your hands. Can you try to put your wrist up? Raise your wrist up. Good. Raise your, lower your wrist down. Push against. Good. Other side. Try to lift up. And push down. Good. And squeeze my fingers. Good. All right. Okay. Just going to double check these things here. Good. All right. So now we're going to check your neck vessels as we lay you back here a little bit. So I'm going to help support you to do this since we don't really have a doctor's table. I'm going to help support you and take a look at your jugular veins. Lay you back between 30 and 45 degrees and have you look this way, a little farther. Okay. I don't see any pulsations of our jugular vein. Have you turn your head the other way? Okay, good. No jugular venous distension noted. Okay. So now have you lay back. And we're going to finish the assessment of your heart here. Okay, so first thing you do is look at the chest, see if there's any pulsations or abnormal chest wall deformities. See if there's any, like I said, areas where you can see the pulsations at all. Okay. We're going to palpate for the apical pulse if we can. Any abnormal thrill. I do have the apical pulse here about the fifth intercostal space, the mid-clavicular line. So I'm going to go ahead and check the heart rate for 15 seconds. Okay, nice regular rhythm, about 58 is what I got. Okay. It's a little low, but I know she runs, so that might be within her normal range. And check 5 locations, the aortic, pulmonic, Erb's point, and then the tricuspid and the mitral locations. I'm going to auscultate with the diaphragm and the stethoscope first. Okay, we go back with a bell, listen for murmurs. Okay, have you lean into me just a little bit, turn on your left side and listen for a murmur here. Okay, no murmur noted there. Good. Okay. Now we move on to your abdomen here. Take a look at our abdomen, make sure the contours are normal, it's not distended. I'm going to start by listening 2 or 4 quadrants, starting in the right lower quadrant, listening for bowel sounds. Okay, good bowel sounds there. You're going to also listen for abnormal sounds of our vessels, the aorta, with the bell of the stethoscope. Okay, no bruise noted there. I'm going to percuss the 4 quadrants in 3 different spots for each quadrant. Then light palpation. Any pain there? Okay, I'm going to test the range of motion of her hips. Okay, so if you lift your right leg straight up, good. The left leg straight up, good. Now with the right leg bent, lifted up, can you rotate your knee out? Can you rotate your knee in? Good. Can you bring your leg down and cross it over the other leg? Bring it straight down. Can you bring it out? Can you abduct? And then cross it over the other leg. Good. Okay. With the left leg, bring it up bent. Bring your knee in. Bring your knee out. Bring the leg down. Move the leg away from the center of your body. And then cross it over your right leg. Good. Can you try to lift this leg against resistance? Good. You try to move it out against resistance. Good. Try to lift this leg against resistance and move it out against resistance. Good. All right. Can you just look at the color of your legs? The hair distribution looks good. Temperature feels good. I'm going to check your pulses here. We'll start with your popliteals. Posterior tibial and dorsalis pedis. Good temperature. No edema noted. Can you move your ankles around for me? How about the other one? Can you try to pick your ankles up against resistance here? Try to pick your toes up. Okay. Push them down. Good. Can you curl your toes? Can you splay your toes wide open? Okay, skin looks good. I would check capillary refill. I can kind of check it in the skin, but she has her toenails painted here, so that makes it. But the skin looks good. Good capillary refill on the skin, not necessarily the nail bits. Can you run the heel of this foot down your shin? Good. Good cerebellar function there. Heel of this foot down your shin. Good. Check your Babinski reflex. Good. No Babinski. That's a good sign. All right. Now you sit back up. And I'm going to check the strength of your lower extremities. If you could push out. Good. Pull in. Good. Push out. Pull in. Good. And check for patellar reflex. Good. Good. And if you close your eyes, and I'm going to give it some light sensation, tell me where I'm touching.
My foot.
Okay.
Same place on the other side.
Okay.
Top of my hand.
With your eyes still closed, can you hold out your hand and tell me what I put in your hand?
Pen light.
Okay. And the other hand, open up.
The stethoscope.
Okay. And let me see your hand again. Tell me which way I move your finger.
Up.
Okay, good. All right, you can open your eyes, and can you move your hands back and forth quickly? Okay, good. All right. And now we're going to have you, maybe so we can be in line with the camera, have you start at the wall, and walk across the room towards me. All right, nice steady gait there. Turn around. Now walk heel to toe. Put your heel to your toe. There you go. Good. All right, now walk on your toes towards me. Good, and walk, turn around, walk on your heels. Okay, now you can come back here. I'm going to have you close your eyes and try to stand still for 20 seconds without tipping. Five more seconds. 20 seconds is a long time. Okay, you're all set there. And now you can give yourself some support on the bench if you want to. But stand on one leg and try to do a deep knee bend on the other leg. Good. And then try the other leg. Deep knee bend. Good. All right. Well, thank you so much. I appreciate you being my test patient.
Actually, my pleasure.
We're finished here. Professor Glaudet, thank you for your time. And this is John and Suzanne signing out.
Thanks.